to the cloud. Hello, everybody, and welcome back to another episode of the Feeling and Healing podcast. I am your host, Danielle Z, MFT in the making, motivator, and mental health maven. And today I am so happy to be welcoming Sabrina Fletcher. Welcome, Sabrina.
Hi, thank you, Danielle.
Of course. She is the proclaimed TFMR doula or parenting loss doula. So welcome.
Thank you.
Of course. So I know we're gonna get dive right in, but I just was curious, and I know we've had conversations in the past, and you're very open, and thank you for your trust and your bravery for being open about kind of your businesses and coaching's origin story. So just I guess if you could just tell the audience, what led you to down this path and what inspired you to do this kind of work.
Yeah, so becoming a pregnancy loss doula and specifically supporting TFMR, which is termination for medical reasons. So when something has gone wrong in a desired pregnancy, there's a horrible medical diagnosis, either in the baby or the pregnant person or both, which was kind of my case.
Mm-hmm.
Um, yeah, that's where I come in. I have groups and communities and support for families who are going through this, in the horrible decision diagnosis place, and then in the grief afterwards that continues. And I got into this work because it happened to me as well in my second pregnancy. So my older daughter was 4 years old at the time, and we were all so excited. We had her before we got married, and then we got married, and then we got pregnant with the second baby. But at the 11 to 14 week scan, so it's like the late first trimester, they're looking for different genetic markers or possibly other anomalies like from the heart. Can't really see the brain develop. It just hasn't developed
Yes, yeah.
enough to see if there are anomalies at that point, but different markers can show up. And the doctor got really quiet, and then he said, I'm sorry, your little baby is very sick. And then he started explaining what he was seeing, that he was seeing that there was swelling all over her body. He called that hydrops. So it's like a diagnosis on its own, but it's also considered a condition or a marker for other underlying conditions or possibly another diagnosis. And unfortunately, we didn't have enough time to really find out what the underlying cause was, but just hydrops on its own um, is most often fatal,
Mm,
unfortunately. Sometimes it does resolve, but it was already very severe and at
mm,
such an early age
yeah.
of development for her. And there were also other things, so it wasn't just that there were other anomalies that were showing. There were these cysts on the back of her neck that he called cystic hygroma,
Mm-hmm.
and also no nasal bone, so she could have had T21, T13, T18, or some other, some de novo, like it just happened in that, mixing of egg and sperm.
Yeah.
We don't really know.
Yeah, the reason why.
No, no, but we could see.
Yeah.
He pulled up pictures of what the ultrasound should have been looking like and then what we were seeing. Like I could see it with my eyes.
Yeah.
And I
Yeah.
also felt in that
Oh,
moment, like this, I kind of know what I'm gonna have to do. And yeah, like we're gonna lose her, you
mm,
know,
yeah.
just coming to terms with that reality, and then being hit with what that was actually going to look like legally, because I asked him, could you help me? And he said no.
Oh,
Like
yeah, like
the state that
terminating.
we're in, yeah. And he does these procedures all the time. Like he's a OB/GYN, like maternal fetal medicine surgery. He does these.
Hmm.
But what couldn't help me in the state that we were in unless we took the case to the hospital and went through the ethics committee. And
Oh, wow.
I just said no, I couldn't put myself through that. And these were decisions that in the moment, in that like, crisis, survival,
Yeah.
just everything kicks in. I mean, looking back, I knew that I needed to do that, but it still, it took a few days for us to really come to the decision.
Well, absolutely. I mean, not only just for you, for your husband, for there's many people and souls involved in a decision like this. Well, yes, you're the vessel that is carrying your baby, but
Yeah.
and then also too, just like dealing with the medical community as well.
Right. And like you need an appointment, and what are the different ways and all of that. Or
Yeah.
what would it look like if we did continue? And he said
Mhm.
if we did continue the pregnancy, he said this is now a high risk pregnancy and I need to see you once a week.
Wow.
And I didn't really understand what that was about until like over the next few days we really dove into all of the research and the statistics and like every single paper that I could get my hands on that wasn't behind password protection.
Yeah. Yeah.
um and I found out that high drops can also cause, it's kind of like a form of high drops in the mother.
Oh,
So the
wow.
swelling could have, and they call it
Have
mirror
impacted
syndrome.
you.
Yes. So I could have had swelling,
Mm.
around my heart, my stomach, organs.
Yeah, no, absolutely. Yeah, and I want to also thank you for just your honesty and your transparency and your bravery for sharing your story because I think we live in a world that and I'm sure I don't want to take away from your experience, but I'm sure people looking at this situation, they see it as a grief, but obviously this is heartbreaking. Um, it's not because it's not traditional. It's hard for people to understand if they haven't been through it themselves.
Mm-hmm. Mm-hmm. Yeah, and I think we even have this idea in society that stillbirth is a thing of the past. Like the word itself sounds like from the 1700s,
Yeah.
1800s, like you think, "Oh, that doesn't happen anymore. We have modern medicine and we can fix things." And no, it does still
So,
happen, and it's like 1 in 160 pregnancies.
and that's a
it
pretty high.
it could be more now with the state
Yeah.
of maternal healthcare in the US. It's higher in because of the racism that's inherent in the medical system. People don't get as good of care if
Yep,
they're browner, blacker, indigenous.
for sure. Yeah. I mean,
So the
it
number even
is.
goes up
Yeah.
in those groups,
Yeah. And
unfortunately.
yeah, no, I mean, then thank you for the space that you hold for the people that, go through this because this is unfortunately just I hope I don't wish this upon anybody, but it
Oh no.
essentially it's a possibility if you are, trying to have a child. This could happen. It could potentially happen. I mean, you don't want it, but life just you get what you don't have control over it.
No, no, you don't. But the human systems that we've built around it, we do have more control of that. And right now they
100%,
are not
yes.
set up to care for people in these situations as well as we should be.
Yes. And I think, and I don't want to get too involved in this, but I think a lot of it, which is unfortunate, has to do with, and I'm very vocal about this, has to do with the insurance model.
Oh, mm-hmm.
And it's even for me, and as you're part of like I would consider you part of we were just talking about this part of the medical community because this is something medical. I mean,
Hmm.
terminate for medical reasons. Like, you know what I mean? There's something medical.
Yeah, it's like therapists and doulas were like medical adjacent, very close.
But
Hmm.
now I hope, and we were just talking about this, I hope that we're part of the wave of like dual healing mental health. That's health. I don't care.
Health.
Like, yeah, it's like let's take the physical, let's take the mental off of it. It's health. Like your
Hmm.
well-being, health. Like, so I hope that we're part of the movement, I guess, or part of the times where I feel like, and even as a therapist in training, I feel like, I mean, I'm trained not to really diagnose, but the way the
Hmm.
our medical model, especially in the US, is set up is so not actually beneficial to the provider. Um, that's actually why a lot of therapists don't take insurance because they just make it so hard for you to work with them. And then also too, that impacts your access to care. So, it's like you don't it's hard when we live in a system that everybody needs so much help right now, whether it be mental healing, and there's only limited amount of people that can give it to you.
Hmm. Hmm.
Or it cost, I get it. The people, it's a very expensive time to live in and there's costs. So I'm very hopeful that there are people like us, like providers or practitioners and also too, people are going more, holistic routes, preventative and being open to that. And I'm not dissing Western medicine or the insurance. I mean, I have health insurance. We all need it, but I haven't met a country or a system that's perfect, but I think there's a lot of improvement um, that could happen collectively when we take and we live in America when we take the dollar out of it.
Mm.
You
Hmm.
know, I
Hmm.
think, and I think that's the work that we do is like you're doing soul, grief,
Mm.
healing. Like as much as you have to make a living, and this is your impact. You're changing somebody's life.
Mm. Yeah, it's life-saving care to
Hmm.
actually have someone beside you who says, yes, this is grief. Yes, you
Yeah.
can call this a baby. Yes, this is baby loss. Yes, let's, learn how to sit with this or what, whatever the healing needs to be, or like, here we are in this community and I see you as a grieving mother. I'm a grieving mother.
Yes.
Let's care for each other.
Absolutely. And I think that's the beautiful thing about I think and no offense to men, but women are really great at forming community. I feel, and they're very great. They're really good at seeing others and building that because I'm sure the women that I don't know if you do groups with them, but I'm sure that would impact. I mean, I'm sure the group work, if you do group work, is so impactful because nobody, if you haven't gone through it, you can tell somebody until they're blue in the face, but until they go through it themselves, they really don't understand.
Yeah, definitely.
Yeah, and it's one of those things like I think there's this, universal, I've had people on the podcast talking about like grief. Like there's this universal understanding of grief. But specifically I think with the decisions you have to make as for a medical termination, that stress is so I can't even imagine.
Yeah, it is unimaginable even for us going through it. Sometimes I look back and I'm like, how did I even survive that? How
Yeah,
did
how
I
did I
get
get
through
here?
that? How did I how did I do that? It was just pure crisis mode, pure survival mode. And yeah, and that's where a lot of people find me, in that place. And um they're craving hearing other people's stories, even stories of other people who have um maybe made a different decision, like continued the pregnancy, because we have to consider, like, what will it look like in this way, what will it look like in this
Yes.
way, or what would this look like, or if I labor and deliver the baby, or if I decide to get a D&E, or where and what hospital and who will care for me, all of
Yeah,
those things.
absolutely. And that you just sparked something in my brain too. Not only like as women, we have to, I said we're the vessel, but it's like you have to look at your baby's health and also yours. You said you had to consider your own well-being, um, and your own health, which is, you have to, that's something, I mean, that's top of mind to me, but That's also a very difficult decision when you're the one who's, just as I said, the vessel of this response. You're already a parent because your mothers especially already parents when they conceive because you're responsible for this other life living in you.
Hmm. Yeah, and I just remembered another reason why I decided to end the pregnancy or induce early is because I found out that in pregnancies that do continue.
Women, their own health has to be considered. And you were just saying you remembered something in your experience. I don't know exactly what you were remembering, but
Oh, I'll just start there then.
yeah.
So this is bringing up another memory for me and another reason that I decided to end the pregnancy, terminate the pregnancy, or induce early release this pregnancy was because I learned that if the babies do survive to a, I don't know, viability point, which I don't even know how many weeks that would be, 28, 32, 36, maybe until they were, in distress in the womb. I don't really even know what that looks like in each individual case, but um, to even give these babies even a chance to survive like a minute, a few minutes, a few days outside of the womb, they will do, it's not even a cesarean section. It's called an exit strategy. And they cut in like so quickly, and it's a vertical cut, and they remove the baby along with the placenta like all at once. So it's a huge trauma to the uterus. And I wanted to have other children as well.
Yeah, you
So
had
I had to think
consider, yeah,
about that
your
as well.
future.
And
Yeah, yeah.
and then I was thinking like what a huge medical trauma that would be, for the baby too. And then that's they're only
Absolutely. Like
that's they're
entering the
only
world like
5 minutes
that.
of life. And
Yeah. Yeah, I mean, I just know as a therapist in training, like that, you're from the time you are enter this world to, I mean, the first like 7, 8 years of your life, like that impacts your attachment style, it impacts your nervous system. Like that patterning is really wired very early on in life. So and it's good that you are so conscious of that. But thank you for bringing that up because it's, people that have potentially trauma later on in life. I don't know. I mean, if they can trace it back to maybe a traumatic birth or they were a breach or whatever, or surgery, like they're more I guess evidence-based studies being done and linking things back to birth and that experience,
yeah, yeah,
you
it's
know?
definitely real. Well, it's going to imprint, if it's going to imprint anywhere, it's going to imprint on your body, your mind,
Yes.
even if you're not making, full on,
Choices or
real
yeah,
memories at that point. It's like, why don't we remember the first 2 years of life? But somewhere in there we do remember in a
our
different
body
kind of
remembers.
way. Yeah, yeah.
Our
So
body, I mean, not to, I quote this book all the time, your body keeps the score. So, and like that's what I'm finding. And I think forgive me if I shared with you before, but like I'm adopted. Lovely adoption story, like picture perfect, like no trauma. My parents welcomed me, my whole extended family welcomed me and my brother. We didn't come at the same time, but just like both my parents adopted children. Like no family issue, like people like questioning, "Oh, why would you adopt? Why would you adopt?" But just because when I was born, I mean, pretty immediately, I think I was, taken from my birth mother and then put in a foster care system for, in like for like, I think probably 6 months, my first 6 months of my life. Like, I don't remember this, but I'm pretty sure I had multiple caregivers, between the ages of 0 and 6 months, not that consistent care, like I developed anxiety because of like that was my attachment style, and that's why like I don't want to say I have abandonment issues, but I've talked to that with my therapist, like, and she's like, yeah, like essentially like, well, yes, your story is beautiful and you have loving parents now and everything simply worked out, like my body still remembers that experience, like being taken from my, even though like I didn't even remember, I don't remember it at all. your body will remember it.
Mm-hmm.
And it
Yeah,
is a
of
loss,
course.
you
That's
know?
many months of your life.
Exactly. And it is a loss too. And I know you also reached out when I wrote recently an email about my adopted mom when she passed away. Well, I tell you, Sabrina, when she passed away, like I thought, because she was sick for a bit, she was in a nursing home. Like she just we that it was just a very, very stressful time for my family. So I actually thought I was gonna be like relieved, but let me tell you, my body told me when that grief, because it was like, but and I actually had somebody in my classes tell me, they're like, or one of my professors actually was like, they're like, Danielle, like don't you realize like you've lost two moms? And I'm like, I never thought of it like that.
Oh,
Like I never thought of it. And that's why like it hit, I mean, of course, it's your mother, like anybody, it'll hit you, like I don't care how old you are, it impacts you greatly. But for me, I was like wondering, I was like, why am I like, I like, got depressed, of course, like, and I was just like, why is, like, I was like, I thought I'd be like relieved, like, she's not in pain, she wasn't in pain, she was in a better place, like I had a lot of um peace with it. But my it just hit me like a ton of bricks, and the grief and the, I like definitely had a little bit of a depressive episode because of it. And then now looking back, it makes total sense, like of why.
yeah.
But in it, I was like, why am I reacting like this,
Mm-hmm. Yeah, and that's so interesting because that can happen within my community too. Of course, it's
With
different,
other children, yeah.
but it happens because, you know, we have this idea that like abortion, you choose it, so that's what you
Mm,
want. So it's like good, so then you're relieved and then you can move on.
mm, yeah.
But this is similar psychologically to removing a loved one from life support.
Yes. Oh,
And
I like that metaphor. I like that metaphor.
you're still losing a loved one. You're still losing your baby. You're still losing your child.
100%.
And I hear people, sometimes people come into the community and they say something like, you know, I've been grieving and the procedure is coming up, like I've worked through it. And
Mm,
it's like it's just about to begin.
yes. Yeah. Yeah.
Because I felt that way too a little bit, like, okay, it's going to happen on this day, so like I'm saying goodbye, I'm saying goodbye, I'm saying goodbye. And then my baby died and it was like
Yeah.
just a whole other
Yeah.
a
Well, I
whole
mean, I
other
think like
experience,
visceral,
you
yeah,
know,
like
because
visceral experience. Yeah.
yeah, because we can feel relieved that, okay, yes, they're no longer in pain. Yes, we were able to get whatever care. Yes, that, you know, they've finally, you know, passed on,
Sorry.
and you've lost your loved one.
Absolutely. Yes, I apologize for that little mishap. We'll edit that out too. But yeah, no, I think it's one of the, once again, I hate to sound like a broken record, but until you're actually experiencing it, you can't, like, yes, you can predict and logically we know, but then also too, our emotional side of our bodies, our brains, our, that maternal, I'm not a mother yet, but I know there's that, that instinct, like that all impacts your journey. And while yes, like everybody heals differently, everybody approaches things differently, every experience is valid. But for I hope that people give themselves grace. I hope you gave yourself grace through that process, because it is a process.
Mm-hmm.
It's
Mm-hmm.
it's not, and also too, I would tell this to everybody all the time, which, like, I actually had somebody on the podcast a while back, in the beginning of the year. She's like a grief kind of coach, and she had lost her son to cancer. And and I think it was, once you experience grief, like there's no end date for it. I
Mm.
hate to tell people that, people are like, oh yeah, like I'll get through it or I'll get over it. And I'm like, No, like you learn to live with it, you heal, you move forward, yes, but the grief doesn't go away. It just, it comes in different, it just takes a different form. And it
Mm-hmm.
usually, life moves on, of course, but you don't forget.
Yeah. Yeah. It was Megan Devine that talks about, um, you know, we learn how to carry it.
Mm, Yeah. Yeah.
And those are the the muscles, I guess, that we work out in the groups that I run and the programs that I do. I have a membership now as well where we
Hey.
have,
Yeah.
yeah, where we have monthly circles. Actually, one of my circles is named the Feeling and Healing Circle, just
I
like
love
this
it.
podcast.
No, I love it. I mean, it is
Be,
because that's what, well,
you because we were never taught, like we were never taught how to feel, and that actually the feeling of the grief is the healing. Like,
oh, 100%. That's the first step. You know, like everybody, that's what I say. There's a saying in the therapeutic community, which is very cognitive behavioral therapy, but it's like you have to name it to tame it with feelings. And
yeah.
we're not even talking about grief. We're talking about any feeling. Like in order to regulate a feeling or heal it, or you need to feel it first. And I think
Mm-hmm.
unfortunately, and I mean, I'd like to see the newer generations like being more open to feelings and expressing their feelings because we did live in a time not too long ago where,
Mm-hmm.
like feeling was labeled as like bad or oh, you're too sensitive or oh, and it's like no, this is my experience and I think we're making a lot of headway. I'm not saying that we're totally there yet, but where like emotions are real and they are valid. And as we were kind of talking, like they are health and they are medical. Like they're not just this woo, like, they're not just this like woo woo thing. Like your body is producing this, you know?
Yeah.
You know?
Well, and if you look at like on the worldwide scale, like in politics, they play on our emotions to get
Our
us to
marketing
do
play on
things.
our
Yeah.
emotions, like our psychology. Yeah.
Yeah.
It's all about
Which is why they don't want us to feel and heal, because then we're actually making decisions from places that, we have a wider perspective on what's actually going on.
exactly. Oh, 100%. As much as, I love that we're talking about a lot of systemic things, but that's all it is. I mean, think you said the system, it's like the marketing system, the healthcare system. I mean, I know in the US we're one of the only countries you can market to consumers pharmaceutically and medically. And they are food. Like the chemicals in our food are designed to make them like fast food specifically. I'm not saying the healthy food, but fast food specifically is designed to make it addictive. So you want it more, you crave it more. And as you said, like, just making sure like owning your own, knowing that you have agency in your life, I think is important and you're not, a victim of like, yeah, we're all gonna be part of this system. I mean, I don't plan on moving, but just being aware of these little things, I think is super helpful in your decision making around your health, around your mental health, around your fit, everything.
Yeah, and not I don't want to present it in like a disempowering way, like the system has all
No,
control
exactly.
over,
Yeah, no,
but
no, they
more
don't.
just
They
like in an
don't.
empowering way, like you can make tiny, teeny, tiny little choices, because especially through a TFMR baby loss, we can feel like all of our choices were stripped from us or
Mm,
like forced in certain directions, or like the restrictive laws, or even people in the community who can go to the hospital across the street, they then meet other people in the community and they see like this in general is happening, and people are not being, families and women, the mothers are not being treated very well through this type of baby loss, and that it really hits you, in the heart.
yeah, absolutely. I mean, if there's anything I always say, like, I always say this, and I have a family friend who their son died when we were in high school, and like I saw the impact of that. Even I was only, yeah, I think I was a freshman or a sophomore in high school. And and that was of course like a fully, I think it is such a unnatural process for a
Mm,
to have to decide whether to, terminate a pregnancy or experience the death of a child. It is unnatural. That's not the way life is supposed to happen. Yes, we all experience death. Like even with my mother, I say, like, yes, it happened a little sooner than I wanted it to, but that's something that I was you experience as a person. Your parents will they're not going to be around forever. But for it's just like a total upheaval. It doesn't like make logical. It doesn't make any sense to me. So people that have been through pregnancy loss, child loss, I'm like, you guys are like superheroes because I'm like, I don't even know how I would get up the next day. But I mean, you do. I mean, a lot of people say that their other
You
children.
do or you don't.
True, that is true.
A lot of laying in bed, a lot or
Yeah, no, but that's the healing, right? And there's no
yeah.
straight like that's what I say, like, like that's if that's what your body needs, like that's what your body needs, and because yeah, like of course too, there's the whole physical
Mm,
aspect of it too. Like, if you like, you're carrying something that you can't, then you're not going to ha be carrying anymore. There is
mm,
that relationship with your body too, not just the decision you had to make, the loss, the grief, the emotional piece. There's also the physical piece as well.
mm-hmm,
And then
mm-hmm.
the physiological of mind, body, and all that. So it's a lot to handle.
Yeah, of such an intimate death that happens through your own body. I've heard it talked about as like the closest to your own death that you
Mm,
will
yeah, that you will.
get until you're upon your own death.
Mm,
And I've also heard it spoken about as an out of order death.
yes.
Makes a lot of sense, like we have this idea like yes, I know I'll lose my grandparents, they're older, and then yeah, one day, my parents will die as well, but you don't think of your child or
No, you
or
never,
that it will happen
it
in a
never crosses your
pregnancy
mind.
or
Yeah.
that you'll have to choose, you know? It's like a moral injury is what it
Absolutely.
feels
Well, yeah,
like.
because it tests in real time, tests you have to make a decision. And
Mm,
um, I'm glad too you said like, like you took a couple days and you definitely took your time because it's a life clear the definition of a life altering decision.
yeah,
Yeah, no,
yeah,
somebody's life is at stake, whether it be your own, the child, a life is at stake. So it should be taken very, very seriously.
yeah, yeah. It's up there but probably as a therapist in training, you've seen that list of like the highest stressors, in life, like a
That's
move,
traumas. Yep, yep.
getting a new job or losing a job, like all these changes, and of course, a death of a loved one way up there,
Yes.
divorce, or even getting married, like all of these life transitions,
100%. Yes. Change
which
is not easy, whether it be good or
yeah,
bad change.
no, which is why. And I know I was saying this before we started recording. I said, well, you can call me a pregnancy loss doula. And I feel like, yes, I am. And I'm also more. But I do like the word doula because, um, it's the person who's there in transitional times, the
Yes.
person who's there in these liminal, like in between phase times, or, a rite of passage place.
Mhm.
And that is what is so lacking in the experience. And even within like our family and friend group, like often there's no funeral, there's
Yeah,
no
there's no like
demarcation
acknowledgement
that like
of the
this
loss.
has changed this person and the family, the parents, the siblings. This
Oh,
has,
yeah,
you know changed them fundamentally.
for the rest
we
of
are
their life.
now we are now in a new phase, a new place. Just like, you put on the gown and the hat, and like you walk at a certain way, and you
Yeah, exactly. Yeah, for
shake
your
the hand. Like
graduation.
we have these rituals because our body needs rituals, our
Yeah,
mind needs
that's
rituals,
a great point.
the
That is a great,
spirit needs it. We need to be seen in our transitions. We need to be
yeah.
seen as something new, something different.
Because yeah, you're not the same. I use the metaphor of kind of like, and not to be negative, but when you're going through kind of hardship in life, whether it be something we're talking about, death, changing job, losing a job, it storms, and you're not the same person after, like if you experience some sort of storm in your life, you're not the same person that you were walking into that storm. You are changed forever, whatever that experience may be. So I like to use that metaphor a lot with just like life, because I know like, and also too, on the, beautiful side of the coin, like straw, I mean, just in, I know that being living by the beach, like every time there's a storm here, you rebuild stronger. Yes, it's devastating, of course, but then, I live at the Jersey Shore, so Hurricane Sandy ripped through this place. And let me tell you, like, if we like, then of course they did redid the flood maps, and everybody had to go up and people had to rebuild. But I will say it's a much better, place now. And thank God that that kind of happened, because you can't build the houses like you were building back in the day, like now. They wouldn't last. They wouldn't even last a nor'easter versus a hurricane that hit like that. So you have to you prepare yourself, not in a bad way, but like in a I have an issue with the word resilient. I don't know if you feel the same.
Yeah,
I
yeah,
haven't I have a complicated relationship with that word.
yeah. It's complicated.
Yeah, because it's like it's resilience, like you're building your resilience, but it doesn't feel like that. Like it doesn't when you're in it, like you're building it when you're in it, like it doesn't feel like if you feel actually quite the opposite. Like you don't feel resilient at all when you're in it.
No, no, like what you said before, like, oh, you're heroes, you're so strong for going through this. And it's like, I actually felt like, a snail that, like, the shell had
Oh,
been ripped off, like the most vulnerable and tender and like open and just like blown apart that I had ever felt in my whole entire life.
yeah. Yeah.
And it's actually in that place where the love and the connection with my baby is too. Like parenting is just inherently a very vulnerable thing. It
Yeah.
is vulnerable. So, yeah, this idea of, oh, be resilient. It's like, actually, I don't want to be strong. I
Yeah.
I want to be seen as, like this was a sad, tender, awful, and family and
Yeah, kind of
child loss.
give it the space that it needs to. And I think that's a great point. I think like when we look at people just walking through life, there are just some people that I'm like, how do you like
Yeah.
I'm just like, how are you still here? Like, and still also to the attitude after it, like, because like things change you. I understand if people
Mhm.
are a little tainted or have different opinions after certain experiences, because I'm like even at my internship site for my therapy degree, after you listen to like trauma for so long or something for so long, it's hard that it doesn't indirectly impact you, of like, or maybe your view on something. So the hope, I guess that's what I'm saying, like the hope of the human spirit is a complex but yet beautiful thing, that we continue, you know?
Mhm. Yeah, 100%. And I think even that comes into the decision
Mm,
that that we have to make because we're thinking about these babies or our own body, and like the spirit in that. So
yeah.
and then afterwards to be told like, oh, what you did was illegal, or when the laws are
The
being
shame, yeah.
changed in the state where you live, like what you did was awful, you're a monster. Or now they're they're like, I don't think the laws will get very far, but they're trying to like allow murder if a woman has used any type of contraception, like you can just attack her.
Yeah, I mean, I feel, and like, I don't want to make this into like a political conversation, but also too, I'm like, when I think we've gone up very much backwards, in that area, and it's your women's bodies. Everybody has their own decision making. I don't think there should be any shaming. If you are not in the experience to yourself, there's no room for judgment, like, and it's awful because yes, there are laws in place that you might not live in a place that is in alignment with your views, and that is
Mm-hmm.
very unfortunate. Because it's also too going back to It's a health issue. It's a body.
Mm. Mm-hmm. Mm-hmm.
And it's unfortunate that that's the one thing that I'm with our country, I think is a little bit backwards right now. The direction and that was a big like to me that was a big like when that was the whole like I forget how many years ago when
Oh, it's been like three or
yeah 3 years.
four
Like,
now.
I
Mm.
remember the day vividly. I was like it was in June. I remember it was a Friday in June and it was like a nice
Mm.
day and I was enjoying the day and then I saw and I was like how like the ruling and I was just like man like we just went backwards big time. And I was just like, I just hope too for just people's health and safety. Like, like I don't know, you don't want to like, I don't want to blame the system, but you have to consider, you know, and I know the world we live in, it's very complicated, but yeah, like nobody should be shamed for making a decision that is best for them. And yeah.
Mm.
Nope. And that's what I think what the laws unfortunately do in the states that, don't support termination and have different I'm not an expert in law, so
Mm.
like it's unfortunate that you also have to hand on top of grieving and the, crazy experience you just experienced, you then have to worry about, oh, like how people are going to view me or how the law is going. It's like that's the last thing you need when you're going through this.
Yeah. Yeah. It makes it so much more isolating
Yeah.
and harder to heal,
Absolutely.
which is exactly the point of those laws. Like they were made to like mentally torture us.
Mm. Yeah. I mean,
So that we're, you know, not sharing our baby's name, which would be like a healing experience,
yeah,
so that we're
exactly.
not getting, the community support that we desperately need. I mean, some people do say like, screw it, like this is my experience, and this was you know, the medical decision I had to make. And they even share, even in like religious communities that maybe, you know, think other ways, and then they do have support show up for them. But yeah, it's like that bravery thing again. But
Yeah.
oh, you don't
Yeah.
owe
It's just
anyone
an
your
added layer.
story. And there's this thing that's happening on a societal level where they're silencing, and then when
100%.
we're silenced, then there's no feeling and healing.
You're suppressing your emotions, and then we like and like I could go back to like I mean, this is going to, like the physio I think there's more studies, more things being done. Because we are in a big the medical model, as we were talking about in this podcast, the medical at least in the United States, the medical model rules. Like that's the
Mm.
model we go by. But the diagnose, treat, heal does not work for everything. Yes, for physical health, and depends on what it is too.
Even that can have
Oh,
mental and psychological
yeah, exactly. So
roots.
I think there are, and I guess what you said, when you said something about, forgive me, I like had a point to what I would say. Yeah, I think you like almost like, I mean, like there's studies that like chronic pain, yes, that's a physical symptom, but is tied to your mental health, to
Hmm.
traumas, to we were talking about, birthing traumas that like you can't tell me that's not real. And if you do work on healing yourself and your mental state and your expressing your emotions, getting those emotions out of your body and actually managing them and not suppressing them, that's all what I'm about. That's why I choose to do what I do because emotions, I mean, the word emotion is energy and motion, and if you keep
I
emotion
love that.
yeah, it's energy and motion. If you keep it, if you logically, if you think about it, if you keep energy, like think about just like a pressure cooker, right? Like
Hmm.
you keep
Hmm.
something in, it's just gonna keep on until it might come out. And whatever that burst is, it could be a physical symptom, it could be anxiety, whatever it is. But like, and then you wonder why we have such a crisis in this country.
Hmm.
And I'm like, yeah,
Hmm.
because we're taught, unfortunately, like, oh, don't feel, keep moving forward, like, and it's like, no, we need to take the time to heal ourselves. And yeah, life is life and it'll always trip you up. And I always say with my healing, like I'm always healing. Like I'm always once you
Yeah,
start,
we're always learning how to
yeah,
sit with something new, or like
exactly.
there's
Or
a
yeah,
layer there, or
different experience and like,
yeah.
and
And
that's
then use the tool somehow to like feel through it. Good.
exactly. And like that's
Yeah.
what I mean, that's it's just process. Like I even know now, like um I try my best, especially when I like an emotion comes up, like I sit with it. Like, and
Mm.
I know that sounds weird. People are like, "Well," and I'm like, because I'm like, if I don't sit and feel it, I actually tell this to my dad, which is awful. But because I'm very aware of my emotional processing and I'm like, so if like let's say I'm having an emotion and I'm like sharing it with him kind of, or like having a shared experience, I say to him, I go, would you rather me share my experience now and this emotion with you, or would you rather me stuff it in and then project on you and out of the blue in like the next 24 hours? He's like, no, take your time and talk about the emotion. I'm like, thank you. You know, because that's how it's gonna come out, unfortunately. You're if you I always say emotions too, they're like waves. They're always gonna be there. You can manage them, but you can't control them.
Mm. Mm-hmm.
You
Mm-hmm.
can try to control them, and that builds more, in my opinion, more resistance, but give it the old college try, but your emotions are we're human. They're gonna happen.
Energy and motion.
Yeah.
Yeah, we
Yes,
have to let it flow through, flow
exactly.
with, feel through it,
Yep.
sit with it. Yeah. And no one ever taught me how to do that. Are you a
Oh,
80s, 90s baby?
yeah, I'm an 88 baby. So yeah, like 80, yeah,
Yeah. Yeah. So I mean
nobody taught us how to
we
regulate our nervous systems when we were
you
younger.
know, you would say, "Oh, I'm sad." It's like, "Well, just go study some more. Work
Or
some
yeah, or go
more. Pick up
outside or
another
go hiking with your
shift."
friends or yeah, yeah.
No, it was always just like, "Well, study harder." And I'm like, "Actually, I'm like sad because I'm only studying all the time, you know, like that."
No, yeah, I mean, and that was kind of I think a lot of people in our generation, that was and even, and I can't even imagine like earlier generations that like
Yeah.
back when they said, oh, yeah, especially too, and I know we've been talking about women a lot, but I think I have a lot of compassion for men right now,
Mhm.
especially in mental health, because that
Mhm.
mental health was, it's number one, a very female dominated now fields. Like a lot of practitioners and providers are female, but men are told at a very young age, like, don't feel, suck it up, you know, like men don't cry. And it's like, no, like men have emotions too. And I hate that I feel like they're just like they're not given the permission that women are to feel. And we all should be given that permission because we're all human,
Mhm.
you know? Doesn't matter, male, woman, whatever you identify as, it doesn't, we're all human and we all deserve to feel our own feelings and should be held space for that and not judged and not shamed and not criticized because that's when, and you know, that's just a whole, we could talk about that for, I mean, that's
Yeah.
I could talk about
Yeah.
that for like I want to go on a negative. I want to end on a positive note, but you know, that's why I do think there's a lot of unfortunately there's the crisis we have now because we're in a system that doesn't allow us to really feel all the time,
Mhm.
you
Mhm.
know.
Yeah,
And
and
feeling
it's
is
why
so
we
important.
need it's why we need these safe places or a practitioner that can actually sit with you
Absolutely.
because a lot of us were never taught how.
Yeah. And if you're not taught how, I totally understand. Like you don't know what you don't know,
Mhm.
you know?
Yeah, we have to
You
be
don't know what
kind
you
to
don't
our
know.
past selves that didn't know.
Yeah, for sure. Yeah. But Sabrina, I loved this conversation with you. Thank you for being just so authentic and so, you know, honest about your story. I'm sure many people will find solace and hopefully some comfort in in your story.
Thank you.
Of course.
Yeah, and I want them to know that they are so welcome to join our
Yeah,
community. I have
tell the audience a little bit about, I know your website, so it's the TMFR doula.
the TFMR
Yeah, sorry, I get
doula.
the
Uh-huh.
acronym.
Mhm.
Sorry, T.
Yeah, yeah. I'm sure you'll have
Show
it in
notes.
the show
Yeah,
notes
I'll
so
put it
that
in
you
the
get
show notes because I
the
was, yeah,
order right. Yeah, yeah, yeah.
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 Doula.com.
Um yeah, yeah, because it's a newish acronym,
Yeah.
and it's a term that, you know, we're just starting to get used even within the baby loss community. So yeah, that's where I am at the tfmrdoula.com and also on Instagram, the tfmrdoula. And to join our Facebook group, there's a safety screening, so
Okay.
it's
Yeah.
only
It was
for
only,
those
yep.
who have been through it,
That's
partners as well. We
cool.
even have surrogates in the community, so anyone who's been directly touched by
Got
TFMR can join us. And then we have our live circles, if you want to get more specific support and like direct support with me, that's in the TFMR support sanctuary. And I can share all of these links with you. But yeah, if you go to my website, you'll find all these and see what the next upcoming group
That's
date is. And yeah.
well, thank you for the work that you do because it is needed, and I'm glad you're creating these amazing communities. I wish we didn't have to. I wish,
Mm-hmm.
but it's amazing that you're creating these like support circles, and giving people, giving a space for them to heal.
Thank you so much, Danielle.
Of course. Well, this has been a lovely conversation. And for everybody, I will have everything in the show notes to get in touch with Sabrina. And as per usual, you can find the Feeling and Healing podcast on YouTube as well as Apple Podcast and Spotify. Have a great day, everybody.